The night shift revelation. The rhythmic beeping of medical monitors echoed through the dimly lit corridors of Pine Valley Memorial Hospital as nurse Rachel Foster began her night shift. After 8 years working in the intensive care unit, she thought she'd seen everything, but tonight would prove her wrong. Rachel paused at the nurse's station, reviewing patient charts when Dr. Marcus Sullivan strode past. Something about his demeanor caught her attention. His usual confident stride seemed hurried, almost furtive. The renowned neurologist barely acknowledged the staff as he disappeared into room 412, where Olivia Winters lay in a coma. "That's the third time tonight," whispered Trevor, a fellow nurse, as he updated digital records. "He never checks on patients this frequently." Rachel nodded, trying to dismiss her unease. Dr. Sullivan's reputation was impeccable. His groundbreaking research in coma recovery had earned him international recognition. Yet lately, something felt off about his behavior. As she made her rounds, Rachel noticed small discrepancies in Olivia's charts. The timing of medication administrations didn't align with standard protocols, and several entries lacked proper documentation. When she attempted to discuss these irregularities with Dr. Sullivan earlier that week, he dismissed her concerns with unusual irritation. The night progressed quietly until an urgent call light flashed from room 412. Rachel rushed in to find Olivia experiencing unexpected seizures, her vital signs fluctuating wildly. As she stabilized the patient, she noticed an unfamiliar vial on the bedside table, one that wasn't listed in Olivia's treatment plan. Before she could examine it closer, Dr. Sullivan burst into the room. His face darkened when he saw Rachel holding the vial. "Nurse Foster, I'll take over from here," he said sharply, snatching the container and pocketing it. "Dr. Sullivan, I need to document what medication was administered," Rachel began, but he cut her off. "That won't be necessary. I've already updated the charts." His tone left no room for discussion. As Rachel left the room, she caught a glimpse of Dr. Sullivan extracting something from his leather bag, a set of small, unlabeled bottles with an unusual symbol she'd never seen before in the hospital's pharmacy. Over the next few hours, Rachel observed more peculiarities. Dr. Sullivan made multiple visits to other coma patients, always alone, always during the quietest hours. Each time he emerged, the patient's vital signs showed subtle but concerning changes. When morning approached, Rachel decided to review the security footage from previous nights. What she discovered sent chills down her spine. Dr. Sullivan had been entering the hospital through unused service entrances, carrying unmarked containers, and spending hours in the research wing after his shifts ended. Her instincts screamed that something was terribly wrong, but exposing potential misconduct by the hospital's most prestigious doctor would require irrefutable evidence. As she gathered her belongings at shift's end, Rachel made a decision that would change everything. She would investigate Dr. Sullivan's activities, whatever the cost. The dawn light filtered through the windows as Rachel drove home, her mind racing. She knew the risks of challenging someone as powerful as Dr. Sullivan, but the memory of Olivia's seizures and those mysterious vials haunted her. Tomorrow night, she would begin documenting everything, building a case that no one could ignore. Little did Rachel know, she had already been noticed. In his office, Dr. Sullivan reviewed the night's security feeds, his expression darkening as he watched Rachel's activities. He reached for his phone, dialing a number he rarely used. "We may have a problem," he said quietly. "Nurse Foster is becoming inconvenient." Beneath the surface. The following evening arrived with an unsettling stillness at Pine Valley Memorial. Rachel entered through the staff entrance, her tablet concealed in her bag containing a newly downloaded secure documentation app. She'd spent her off hours researching hospital protocols and pharmaceutical regulations, preparing herself for what lay ahead. "Rachel, just the person I needed," called out Beverly, the charge nurse. Dr. Sullivan left specific instructions that all his coma patients are to be monitored exclusively by him tonight. "He's reassigned you to the cardiac wing." Rachel felt her heart skip. "That's unusual." I'm the primary nurse for 3 of those patients. Has there been a complaint about my care? Beverly shrugged, clearly uncomfortable. Orders came directly from administration. Dr. Sullivan cited some research protocol requirements. Instead of arguing, Rachel nodded and headed to the cardiac unit. But she had no intention of abandoning her investigation. Years of working night shifts had taught her every corner of the hospital, including the overlooked maintenance corridor that offered a clear view into the coma ward. Throughout her shift, Rachel methodically documented her assigned patients while keeping watch on Dr. Sullivan's movements. Around midnight, she observed him entering the ward carrying a silver briefcase she'd never seen before. Through the window, she watched him prepare injections using vials from the case, medications that weren't being logged in any official records. As she observed, a hand touched her shoulder. Rachel nearly jumped out of her skin. "Quite a view from here," said Dr. James Porter, one of the hospital's veteran physicians. His kind eyes held a knowing look. "You know, I've worked with Marcus Sullivan for 15 years. Brilliant man. Perhaps too brilliant for his own good." Rachel hesitated, then took a chance. "Dr. Porter, have you noticed anything unusual about his research lately?" The older doctor glanced around before speaking softly. 3 months ago, Sullivan's grant application for experimental coma treatment trials was rejected by the ethics board. He didn't take it well. Said we were holding back medical progress. He paused. "Last week, I noticed similar anomalies in patient charts. When I questioned him, he threatened to have my privileges revoked." Rachel's suspicions crystallized. "The patients' families, do they know about any experimental treatments?" "That's what troubles me most," Dr. Porter replied. "They haven't been informed of anything beyond standard protocols." Their conversation was interrupted by a code blue alarm. Rachel rushed to assist, but her mind was racing with implications. After the emergency was handled, she used her break to access the hospital's research database. Deep in the archived files, she found Dr. Sullivan's rejected proposal, a controversial treatment using an untested compound meant to accelerate neural recovery in coma patients. The pieces were falling into place, but Rachel needed proof. As her shift neared its end, she noticed Dr. Sullivan heading to the research wing with his briefcase. Following at a safe distance, she watched him enter the secure lab. Through the window, she could see multiple racks of test tubes containing an iridescent blue liquid, the same color she'd glimpsed in the vial from Olivia's room. Suddenly, voices approached. Rachel ducked into a supply closet, heart pounding. Through the crack in the door, she saw Dr. Sullivan speaking with a man in an expensive suit. "The preliminary results are promising," Sullivan was saying. "With a few more weeks of trials, we'll have enough data to force the board's hand. They can't ignore success rates like these." "And the risks?" the suited man asked. "Acceptable losses in the name of progress. These patients were unlikely to recover anyway. We're giving them a chance, even if they didn't exactly consent." Rachel felt sick. She needed to get this information to the proper authorities, but first, she required concrete evidence. As she carefully made her way back to her unit, she formulated a plan. Tomorrow night, she would find a way into that lab and document everything. What she didn't notice was the security camera slowly turning to follow her movement, or Dr. Sullivan watching the feed from his office, his expression cold as he reached for his phone once again. "It seems Nurse Foster requires immediate attention," he said to someone. "Yes, tonight. We can't risk any delays. After all, accidents happen in hospitals all the time." The night shift was ending, but Rachel's real challenges were just beginning. As she walked to her car, she felt eyes watching her from somewhere in the shadows of the parking garage, unaware that her next shift would test not just her courage, but her very survival. Web of deception. The atmosphere in Pine Valley Memorial felt heavier than usual as Rachel began her third night of investigation. Her hands trembled slightly as she organized her equipment, a small camera disguised as a pen, her tablet, and a USB drive. She couldn't shake the feeling that she was being watched. The night started with an unexpected development. Olivia Winters, the coma patient who had seized during Rachel's previous shift, was being transferred to a private room in the hospital's restricted research wing. The order, signed by Dr. Sullivan, cited specialized treatment protocols. "Something's not right about this transfer," whispered Nathan, a veteran orderly who had been helping Rachel gather information. "That wing hasn't been used for patient care in years. It's all research labs now." Rachel nodded, watching as Olivia was wheeled away. "Nathan, I need a favor. Can you get me the access code to the research wing? Just in case of emergencies?" He hesitated before scribbling numbers on a scrap of paper. "Be careful, Rachel. I've been hearing things. Strange conversations. People disappearing into that wing and never coming back out." As Rachel made her rounds, she noticed more disturbing patterns. 3 other coma patients had been quietly transferred to the research wing over the past week. Their families had been told it was part of an advanced treatment program, but the consent forms she found were suspiciously vague. Around midnight, Rachel used her break to access the research wing. The code worked, and she slipped inside. The corridor was dimly lit, medical equipment casting eerie shadows on the walls. She found Olivia's room and carefully examined the 4 bags. Hidden behind the standard solutions was another bag containing the mysterious blue liquid. Rachel photographed everything: the 4 setup, medication labels, and most importantly, a partially visible research log left on the counter. The entries confirmed her worst fears. Dr. Sullivan was conducting unauthorized trials of his rejected treatment, documenting both successes and acceptable losses. As she turned to leave, voices approached. Rachel ducked into a supply closet, heart pounding. Through the crack, she saw Dr. Sullivan walking with 2 men in dark suits. "The results are exceeding expectations," Sullivan was saying. "Phase 2 trials can begin next week. With proper funding, we could revolutionize coma treatment within months." "And the complications?" one man asked. "Minimal. The neural degradation in unsuccessful cases can be attributed to their original conditions. No one will question it." Rachel fought back nausea as she realized the full scope of what was happening. These weren't just unauthorized trials, they were using vulnerable patients as guinea pigs, concealing deaths as natural deterioration. Just then, her phone vibrated, a text from Nathan: "Get out now. They know." Rachel's blood ran cold. She waited until the footsteps faded, then carefully emerged. But as she reached the wing's exit, an alarm blared. Security doors began sliding shut. Running on instinct, she sprinted through the narrowing gap of the final door. Behind her, she heard Dr. Sullivan's voice: "Find her. Now." Rachel made it to the main hospital floor, trying to act natural despite her racing heart. She had evidence now, damning evidence. But she also knew she'd just made herself a target. As she approached the nurse's station, Dr. Porter intercepted her. "My office." "Now," he whispered urgently. Inside his office, Dr. Porter locked the door. "You've seen it, haven't you? The blue compound?" When Rachel nodded, he continued, "I've been gathering evidence too. 3 deaths in the past month, all explained away as expected outcomes. But I found this." He handed her a file containing autopsy reports. The victims' brain scans showed identical patterns of deterioration, patterns that didn't match their original conditions. "We need to stop this," Rachel said, voice shaking. "We will. I have contacts at the medical board. But we have to move carefully. Sullivan has powerful friends, and dash." A knock interrupted them. "Dr. Porter? Dr. Sullivan needs you in the research wing." Urgent consultation. They exchanged alarmed looks. Don't trust anyone, Porter whispered. I'll contact you tomorrow with a plan. But as Rachel watched Dr. Porter walk away, she couldn't shake the feeling that tomorrow might be too late. She had to act now, before more patients suffered. What she didn't know was that her next decision would set in motion a chain of events that would either expose the truth or silence her forever. In his lab, Dr. Sullivan reviewed security footage of Rachel's infiltration, a cold smile playing on his lips. Nurse Foster has made her choice, he said to someone on the phone. Initiate contingency protocol. And make sure Dr. Porter's accident appears convincing. The night was far from over, and the web of deception was about to turn deadly. Cop. Breaking point. The emergency alert pierced the hospital's quiet at 2 a.m. Code Blue, Research Wing. Rachel's heart stopped when she heard the location. Dr. Porter's consultation had been less than an hour ago. Racing to the scene with other staff, she found Dr. Porter unconscious on the floor, an empty syringe nearby. As the team worked to resuscitate him, Rachel caught Dr. Sullivan watching from the doorway, his expression unreadable. Such a tragedy, Sullivan said smoothly. It appears Dr. Porter had been self-medicating. Stress of the job, no doubt. But Rachel had seen Porter's hands just hours before, no track marks, no signs of drug use. This was no accident. The message was clear, no one was safe. Acting on instinct, Rachel slipped away during the commotion and headed to her locker. She had minutes, maybe seconds, before they realized she wasn't where she should be. Her hands shook as she downloaded her evidence to a secure cloud drive and sent encrypted copies to trusted contacts, fellow nurses at other hospitals, a journalist she knew, and her brother at the FBI. Looking for something, a voice said behind her. Rachel whirled to find Thomas Reed, the hospital's head of security, blocking the exit. 2 guards flanked him. Mr. Reed, Rachel kept her voice steady. I was just getting supplies for the emergency response team. Dr. Sullivan would like to speak with you. About your recent concerns. Reed's smile didn't reach his eyes. He's waiting in the research wing. Rachel knew this was it, either she found a way out now, or she'd become another tragic accident. As Reed reached for her arm, she threw her bag of medical supplies at him and bolted through the gap between the guards. Alarms blared as Rachel ran through the hospital corridors, her mind racing. She needed to reach the evidence room. There would be security footage there, documentation of all patient transfers. But as she rounded a corner, she saw more guards heading her way. Ducking into a patient's room, Rachel spotted a maintenance shaft, one of many she'd learned about during her years of night shifts. She pried open the panel and climbed inside just as voices approached. Find her, she heard Sullivan command. She's compromised everything. Use whatever force necessary. Rachel navigated the narrow shaft, trying to control her breathing. The maintenance system was a maze, but she'd studied the layouts during her investigation. 3 levels down and 2 sections over would put her near the evidence room. As she moved, she heard snippets of radio chatter from the guards below. They were sealing off exits, initiating a full lockdown. But they didn't know about the old service tunnel that connected to the parking garage, a route she'd discovered while following Sullivan days ago. Finally reaching the evidence room, Rachel used her ID to gain access. She had minutes at most. Her fingers flew over the keyboard as she accessed the security database. There it was, footage of Sullivan's late-night activities, patient transfer records, everything. A noise at the door made her freeze. Through the window, she saw Sullivan approaching with Reed and several guards. The door wouldn't hold them long. Rachel grabbed a final USB drive of data and looked up at the ceiling tiles. The maintenance shaft continued above, leading to the service tunnel. It was her only chance. As the door burst open, Rachel was already pulling herself up. Gunshots peppered the ceiling around her as she scrambled through the shaft. She heard Sullivan's enraged voice below, "She has proof. Find her. Now." Racing through the tunnel, Rachel could hear pursuit behind her. Her lungs burned, but she couldn't stop. The exit was ahead, just a few more meters. She burst out into the parking garage just as headlights illuminated the area. A security vehicle screeched to a halt, but before they could react, another car roared up. The door flew open. "Get in." It was Nathan, the orderly who had helped her. "The FBI's on their way, but we need to move." Rachel dove into the car as more shots rang out. As they sped away, she clutched the USB drive. The truth about Sullivan's experiments would finally come to light, but first, they had to survive the night. In the rearview mirror, she saw Sullivan watching their escape, his figure growing smaller but no less menacing. This wasn't over. The final confrontation was still to come, and Rachel knew the next few hours would determine not just her fate, but the lives of countless patients trapped in Sullivan's web of corruption. Final diagnosis. As dawn broke over Pine Valley Memorial, FBI vehicles surrounded the hospital. Rachel sat in a secure location with federal agents, her evidence spread across the table: medical records, security footage, and detailed documentation of Sullivan's unauthorized experiments. "Over 20 patients," Agent Daniel Harrison said grimly, reviewing the files. "All subjected to experimental treatments without consent. The mortality rate." He shook his head in disgust. Nathan had brought them to a safe house after their escape, where Rachel's brother James, the FBI contact she'd reached out to, was waiting with a task force. The evidence she'd gathered had triggered an immediate federal response. Inside the hospital, chaos erupted as agents swept through the research wing. Staff and patients watched in shock as investigators sealed off areas and seized computers. But Dr. Marcus Sullivan was nowhere to be found. "We've got movement," a voice crackled over the radio. "Sullivan's been spotted heading to sublevel 3. Rachel's head snapped up. "The backup lab," she said. "He has another facility hidden in the old storage area. That's where he kept his primary research." Agent Harrison mobilized his team immediately. Rachel insisted on going with them, she knew the hospital's layout better than anyone. As they descended to the sublevel, the air grew thick with tension. They found the hidden lab behind a false wall. Inside, the scene was illuminating: rows of sophisticated equipment, test tubes filled with the blue compound, and most damning of all, detailed records of every experiment. But Sullivan wasn't finished. As agents secured the lab, an alarm blared through the building. Security feeds showed Sullivan in Olivia Winter's room, holding a syringe to her foreline. "Everyone out, or she gets the full dose," his voice came through the hospital's intercom. "You have no idea what this compound can do in lethal quantities." Rachel felt ice in her veins. She knew what she had to do. Despite protests from the agents, she made her way to Olivia's room alone. As she entered, Sullivan's eyes locked onto her. "You don't understand what you've done," he snarled. "We were on the verge of a breakthrough. These patients were going to make history." "They didn't consent to be your lab rats," Rachel replied steadily. "They trusted us to care for them, not experiment on them." "Care?" Sullivan laughed bitterly. "You call keeping them in limbo care? My treatment could have awakened them all. Yes, there were risks, but the potential benefits." "You killed people," Rachel cut him off. "Played God with their lives. It ends now." What happened next was a blur. Sullivan lunged forward with the syringe, but Rachel was faster. Years of handling combative patients had honed her reflexes. She deflected his attack, sending the syringe flying as FBI agents burst into the room. As Sullivan was led away in handcuffs, Rachel checked Olivia's vitals. She was stable. All around the hospital, investigators were discovering the full scope of Sullivan's operation. More than just unauthorized trials, they found evidence of falsified results, bribed officials, and covered-up deaths. In the following weeks, the story broke nationwide. Dr. Marcus Sullivan, once celebrated as a pioneering researcher, was exposed as a dangerous egotist who had sacrificed lives in pursuit of medical fame. The hospital underwent a complete administrative overhaul. 1 month later, Rachel stood by Olivia's bedside. The patient had been safely withdrawn from Sullivan's compounds, her condition slowly improving under proper care. Other survivors of Sullivan's experiments were also recovering, their families finally knowing the truth. "You saved them all," Dr. Porter said, now recovered and reinstated. Not just the patients, but everyone who might have suffered if Sullivan had continued. Rachel watched Olivia's peaceful face, remembering the night everything began. "We're supposed to heal people," she said softly. "That's what matters most." As she finished her shift that evening, Rachel passed the now closed research wing. The hospital felt different, cleaner somehow, as if a shadow had been lifted. She had stood up against corruption and won, but more importantly, she had protected those who couldn't protect themselves. The night shift was calling, and somewhere in the hospital, patients needed her care. Rachel smiled as she headed to her unit. Sometimes the most important diagnoses weren't about medical conditions at all, but about recognizing the difference between healing and harm, between ambition and ethics, between right and wrong. The case of Dr. Sullivan would be remembered as a warning to the medical community, but for Rachel, it would always be a reminder of why she became a nurse: to help people, to do no harm, and to stand up for what's right, no matter the cost.